Journey Through Parenthood with Martina Bills.
Brought to you by Southern Ohio Medical Center. Very good things are happening here.
Good morning, everyone. I'm Martina Bills. Thanks for joining us here on the WSAZ Now desk for Journey Through Parenthood. This morning, we are going to talk about lung cancer. It is Lung Cancer Awareness Month in November, and we're talking with Dr. Jeremiah Martin from SOMC about how lung cancer is very tricky to diagnose, but it's also one of the most lethal cancers out there. More people die from lung cancer than any other type of cancer. And I know I've heard these kind of stories before, and you may have too. Someone diagnosed with lung cancer that you know, but that person didn't smoke. And that's kind of hard to grasp when you're dealing with a diagnosis of someone close to you and they've never actually smoked and put those toxins in their bodies. So we're talking to Dr. Martin from SOMC a little bit about how they go about diagnoses, and because there is really no specific screening for lung cancer.
So the challenge with awareness of lung cancer, it really is a disease that, first of all, it's important to know that it is the #1 reason that people who are diagnosed with cancer pass away. It is the most lethal of the cancers. And it has a tendency to go rather undiagnosed because it doesn't have a lot of external signs and symptoms, especially in the early stages when it's treatable and curable. So this is why awareness and screening is so important. Now, we certainly think of symptoms such as cough, shortness of breath, any new respiratory symptom. It's worth talking to your family doctor or care provider about this. But truly, it's raising awareness to the risk factors and then talking about getting appropriate screening done. That's how we catch lung cancer in its early stages and can then cure it, which is the really good news.
Yeah, and let's talk about those screenings, because you often hear about women getting mammograms for breast cancer. What would you say is the best screening tool for lung cancer?
Right. So over the years, we've tried different things. Currently, the gold standard is a CT scan. So we recommend a non-contrast CT scan. So it's a very quick, non-invasive study. It just takes a minute or so to do this. And that will, allow us to look inside the lungs and look for any suspicious nodules. So the test itself is non-invasive. It's very easy to get done. And most insurance providers and Medicare will cover this for eligible patients. So that will ultimately bring us to risk factors. But if there's a significant history of smoking, it's certainly something to talk to your provider about.
Yeah, and that's what I was going to say about those risk factors or family genetics. And the smoking thing always comes to mind when you think of lung cancer. But oftentimes you hear those stories. So-and-so has lung cancer and they never smoked. How do you explain all of that with lung cancer?
So that's a real challenge. And the truth is cancer is something that can strike and happen to anybody at any time. Certainly smoking is the primary risk factor, and I would say that the overwhelming majority of our patients who have a lung cancer will have a smoking history or likely to have been exposed to asbestos or some other issue in the past. But there are a small subset of patients who have never smoked who will find that they develop a cancer. So that is unusual. Unfortunately, we don't have great tests to detect that, but that is where perhaps there might be a family pattern sometimes. That's where genetics comes into play. So if, for example, there are a lot of family members who've had cancer, or if there's a lot of lung cancer in the family, again, it's worth having that conversation with your primary care provider, as there may be some opportunities there as well.
And Dr. Martin, at the beginning of this interview, you were saying how sometimes it goes undiagnosed because it is hard to kind of figure this out. Is this one of those scenarios of listen to your body, ask your doctor questions, don't be afraid to say something's just not right with me?
Right. It absolutely is. This is a case of just being aware, knowing about those risk factors. So our message for November really comes back to awareness. The best cure for lung cancer is preventing it from ever getting started in the first place. So for our friends and family members and patients who are smokers, we encourage them to seriously work on smoking cessation efforts. For folks who've had a long smoking exposure, so we usually look at 30-pack years. That's now being decreased to 20-pack years. So if you've smoked more than a pack of cigarettes per day times 20 years, you should be talking to your primary care provider about possibly getting screened. And then, of course, any unusual symptoms. And the important take-home message as well is that in its early stages, lung cancer is absolutely curable and survivable. So there's a great message of hope that we want to get out as well to encourage people to take these steps.
Okay. Dr. Martin, is there anything else you can think of to raise awareness about lung cancer during the month of November?
So I think the big thing is just talk about it. Everybody probably knows somebody who's been afflicted by the disease. As we come into the holiday season, we're connecting with family members and whatnot. Again, just having conversations about health and wellness and looking to the future is just really important. And again, talk to your provider. Here at SOMC in Portsmouth, we have a lung navigation team. You can contact us at 740-356-LUNG, and a navigator will be happy to talk to you about eligibility and getting screening set up. But most of our neighboring hospital systems have programs in place. So we definitely want people to think about this as we approach the end of the year. And then with the new year approaching, thinking about good habits and smoking cessation.
Good habits and quitting smoking. Those are the top key things that Dr. Jeremiah Martin at SOMC recommends for lung health. If you are a smoker, he says that that's when you should be talking to your doctor about getting screened for lung cancer, because he says if you smoke a pack of cigarettes a day for at least 20 years, which I know seems excessive, but some people do smoke that much, that's when you really need to be cautious of a lung cancer diagnosis. But he does say if lung cancer is caught in those early stages, it is treatable. And, you know, it doesn't have to become a serious issue. Dr. Martin, the one thing he pointed out was how significant smoking does raise your risk for lung cancer. So keep that in mind. But there's also anyone can be diagnosed with types of cancer any day. It happens every day in our country. You hear of someone being diagnosed with cancer, and you consider them an overall healthy person. So some of those, the cancer diagnosis never becomes, you know, less of a shock to a family or friend, but some of those cancer diagnoses do come with someone being a pillar of health, so to speak, and them seeing that diagnosis really makes life very difficult to comprehend. So Dr. Jeremiah Martin at SOMC, a lot of good information, raising awareness about lung cancer. And he says he doesn't want to, he wants to give people hope that their early detection, if that is detectable early, then there is treatment available. And that number, one more time, for the SOMC lung cancer navigation team is 740-356-LUNG, which is 740-356-5864. And here on Journey Through Parenthood, you can also reach out to me on social media. If you have a story idea, you can find me on Facebook, Instagram, and Twitter. Send me a message, and we'll see what we can do about scheduling a segment with that topic that you are interested in. We're here every Monday and Wednesday at 10 o'clock on the WSAZ Now Desk. We hope you have a great day.